sometimes they write the number 7.
Yeah.
But it was just like plus, like you did the other day, you put, I think, the number that were up there for about what we have. My session has a different, you know. So are we ready, DJ?
We are ready at any time.
Okay, I'm gonna start this thing off by saying that I fouled up once and Jenny Ward came over here to do a brown bag, and I'd blown it completely. I had it written in my book, but I hadn't done any I hadn't done anything. I've got it smeared all over our web page, and Brooke Pace smeared it all over the hospital's web page and everywhere else. And I hope that a whole bunch of people are out there and woke up this morning and looked at the smoke and said, I'll watch from home, because we are streaming it, okay? And I hope that, and why people should be interested, those of us who've been here long enough can remember the time in the 1980s when we had 2 doctors in this county and 1 aging hospital, without mentioning names, with an administrator who thought, whose biggest accomplishment was having the lowest room rates in the state of Oregon. But at any rate, we've had just tremendous growth and sophistication in our medical system in Wallowa County, and something we really, really can be proud of. So Jenni Ward is the chief nurse and has administrative duties as well at the hospital and clinics. And Paul Solis is the newest PA in the county. We didn't know what PAs were in the 1980s, did we, Nick?
No.
We barely knew about RNs, but so we've come a long way. And please come on up, Jenny and Paul, and make yourselves comfortable and tell us what's happening with the hospital and the medical system. I'm not going to get in front of it.
You can stand in front of me, it's all right, you just listen, not have to look. No, thank you, Rich, appreciate you asking us to come up and just kind of share. I thought I'd start out maybe a little bit about the healthcare district and kind of help explain what the district is. We'll talk about the hospital and clinics.
I'm going to just aim that a little more.
All
Is
right.
that better, DJ?
Can you please speak, and we'll see.
Absolutely, is that better? I can skip
Closer.
forward. I knew that was gonna happen. Better?
Can you guys hear okay?
Yeah, we're good.
Okay.
All right, well, Wallowa County Healthcare District was formed in 1992. It is the governing body of Wallowa Memorial Hospital and Wallowa Valley Senior Living. And we are fortunate today, Nick Lundy, who is our board chair, is here listening, so he can correct me if I miss anything.
That's why I'm here.
Add to what I miss. Wallowa Valley Senior Living also is the residential care facility, which is located on the campus behind the hospital and medical office building. It is independently managed, but falls under the umbrella of the district, so the board oversees that organization. They offer assisted living and memory care in that facility and done a fabulous job. The past, gosh, we've had new management 4 or 5 years, maybe not quite that long.
About 3 years.
3 years. They've done a great job over there, so it's a great facility to have for our community. Medical campus in Enterprise includes obviously the hospital, the medical office building, and within the medical office building is the physical therapy, occupational therapy department of the hospital, Wallowa Memorial Medical Clinic, which houses primary care, behavioral health, and surgical services, both general surgery and orthopedic surgery, which we'll cover those in a little bit. And then the far end closest to Golf Course Road is Winding Waters Clinic. They are an independent clinic, not run by the hospital. We all obviously in Wallowa County work together with various organizations, but they are independent. Also part of the district is the Wallowa County Healthcare Foundation. As you've probably heard of the Healthy Futures Dinner Auction, the foundation raises money to help us expand and improve healthcare services throughout the county. They have been doing this since 1991. They have raised large amounts of money to help improve care. One of the first things they did was a resident house, which is located on the hill above Safeway, that houses any residents, medical students that come into the county for some rotations. They also raised money to help build our new hospital back in 2007. So now, not only do we have a state-of-the-art facility, thanks to some of their help, it also helps us attract and retain talented physicians, top-notch staff from some of these organizations, universities around the nation. Things that they have helped us with, you've probably heard about in the community: a state-of-the-art 3D mammography system, purchased new 4-wheel drive ambulances so that we can get out to Naha, Troy, and some of those other rugged areas around the county. Helped us improve and make updates to medical equipment, both in physical therapy, surgery, imaging, lab, and nursing. They also help invest in equipment and training for staff. They've contributed to our outpatient therapy, chemotherapy clinics, so those patients that are undergoing various treatments can have comforting options during those times. The next question I was asked to address was, how does the hospital relate to the clinics? So Wallowa Memorial Medical Clinics, the hospital actually got into the, clinic business in 2015. We opened 2 clinics, kind of took over Dr. Boyd's clinics, so to speak. We opened a site in Enterprise in the medical office building, and then in the clinic that Dr. Boyd practiced out of below Joseph High School. And then that got confusing with that name, people not understanding that it was the hospital's clinics and different healthcare entities in the county. We changed fairly recently the name to Wallowa Memorial Medical Clinics to kind of tie in that name and help people understand those clinics were associated with the hospital. Then 2020, as many of you know, Mark and I were just talking, COVID hit. We ended up shutting down the Joseph Clinic. Due to COVID, less number of visits, trying to keep things safe and protected both for staff and patients. And then there was also a flood in that building the day before we were going to reopen, actually. So we held off and just waited for the beautiful new building down the street to be completed to open back up in Joseph. If you haven't seen that building, you're always welcome to stop by and take a peek. We'd be happy to give you a tour. But Joseph now has a great state-of-the-art clinic on Main Street just as you're coming into town, and that opened early April. At the same time, we opened 2 additional clinics, one in, we call it downtown, in Enterprise, in the same building as Olive Branch Pharmacy. It was previously owned by Teresa Russell. She is trying to ease her way into retirement, so approached the hospital. And we have taken that clinic on, and also have the site in Wallowa that she had across from the post office, the little 1-room clinic there in Wallowa. In Joseph, we currently have primary care, behavioral health, and some physical therapy services. It is primarily pelvic health therapy that is being done there. Enterprise location at the hospital, the medical office building right next door, has primary care, behavioral health, general surgery, and then you may have heard in June, Dr. Smith, orthopedic surgeon, joined us. So we now have orthopedic surgeon in the county and are able to expand some of those services. And we expect that that will probably increase as well in the coming months. The downtown location by the Olive Branch Pharmacy has primary care and behavioral health services. And then Wallowa Clinic has primary care and behavioral health services. We are also working with Olive Branch to help incorporate some pharmacy services, whether that may be assisting patients with getting their medications if they're up here in Joseph or Wallowa, doing some courier services, helping primary care providers look at their medications and streamline some of that. So more to come there. And then as we've added all of these locations and had this rapid growth, we've had to add providers to help with that. So obviously Terry Russell has come over along with Mike McDonald and Sarah Peterson from her clinic. They are our nurse practitioners. And then Paul has joined us, physician's assistant, and I'll just take a moment here and Paul, let you introduce yourself.
Yeah, thank you, Jenny. My name is Paul Solis. I'm a physician assistant. Originally from Colorado, but did my training out at Duke in North Carolina. Have a passion for primary care and treating everything that kind of walks in the door to help people live a little bit healthier lives and just more fulfilled lives. So I think that the Wallowa County people are very lucky to have such high level of care, and I'm very excited to be a part of the team.
Awesome. Well, we're thrilled to have Paul. It's been great in the 3 weeks that he's been here, so we knew he'd be a great fit. We also have another nurse practitioner, Katie Weller, that will be starting in August. She does specialize in pediatrics, so that'll be a great addition, but can see the full spectrum of ages as well. And still, Dr. Sheehan, Dr. Kane, Dr. Allen, Tracy Fry, and Jennifer Little are with us providing care as well. And then our surgeons, like I mentioned, general surgery and orthopedic surgery with Dr. Rose and Dr. Smith. The next question that was asked was, where do physical therapy and counseling fit in? So physical therapy, as I said, is in the medical office building right next to the hospital. They provide physical therapy, occupational therapy, and coming in August, we will have speech therapy available, which is fantastic, very much needed. It's exciting to have that addition to our services. They will be based primarily there in Enterprise. Like I said, we have the pelvic health and some limited physical therapy up here in the clinic in Joseph. I didn't mention, but we did recently sign an agreement to purchase the old Fox Archery building in Wallowa. So the hospital, Wallowa Memorial Medical Clinics, are excited to be able to fill that void of healthcare that's been in Wallowa probably for almost a decade now, with a new state-of-the-art clinic in Wallowa, and we do hope to will have primary care, behavioral health, hope to be able to add physical therapy, possibly some occupational therapy at that site as well. So that is how physical therapy is still a department of the hospital, but we're able to branch out and provide it in the outlying communities to make it a little bit easier access for people that live in Wallowa, Joseph, or even farther out. Counseling, we have behavioral health in all 4 of our clinics with a social worker and a qualified mental health provider counselor that is available. They alternate in the different locations so appointments can be made anywhere. We still will continue to work with Wallowa Valley Center for Wellness when needed. Yes, yeah. No one group can do it all, but we all work together and we have a great partnership with them. So.
Yeah, no, I was going to say that I think that being able to have such care and how fluid it is within the county to be able to see a provider in Joseph while also having that same provider be able to be in Wallowa offers the entire community the same care despite where you live. I think it's a very unique resource that the county has here, and it's really good.
Another piece I was asked to cover, just kind of, he mentioned the access, we have it throughout the county. Another piece is just the, I guess, the money piece that we all think about. We want to provide access to anybody that needs healthcare regardless of their ability to pay. We, following the state of Oregon guidelines requirements, have a financial assistance policy that will benefit anybody that has an income up to 400% of the poverty level. We provide a discount to, just to kind of put that in terms that are maybe a little bit easier to understand. A family of 4 that makes $105,000 would receive a 25% discount on their bill, and that is graduated at 100% or lower the poverty level. You would get 100% of your bill would be covered by the financial assistance, and that is graduated up to that 400% level. So another way we try and help access in the community.
Yeah, and the numbers break down for, if it's just a single person, instead of 106, it's 51,000. So that's, that's a lot of the population.
Yeah. So, you get a little better recovery with doing that up front rather than charging people 100% and having them not be able to pay. You told me before what the annual write-off was. It's pretty incredible.
We do, help me out, Nick, here I'm blanking on the number.
It's like heaven.
It's about 700,000.
Yeah, somewhere between $750,000 and $1 million a year in either financial assistance or bad debt.
Okay.
And since we've adopted the 400%, it's gone from bad debt up here and financial assistance down here, and they've reversed now.
Good.
And so, and we started calling it financial assistance instead of charity.
Oh, interesting.
And I think that helped too.
Yeah.
And it is something that we will mention if, that is a big stressor, and stress doesn't help you heal very well. If there's someone that asks a question, or we just get that sense, and we share it with anybody, we don't make assumptions, we don't know what, somebody's income is, but do try and make that available so anybody can apply. It's available on the website, there's a form, there's some things you have to fill out, information you provide, but they try and make it as simple as possible.
And that's 25% of what the patient owes, not what insurance or Medicare
This is
pays.
after insurance pays.
After the insurance.
Or if you don't have insurance, it would come, be 25% of all. And there's other arrangements the business office will help make to make that easier. Go ahead.
What about and I'm sorry I had to run out there, but what about the services of visiting? Did you talk oncology? What all have you got visiting now?
Some of the visiting services, we have cardiology that comes to the county. We'll soon have rheumatology back via telehealth. That was with Dr. Jackson when she was in Baker. She's now out of LeGrand, and we should get the agreement this week to sign so that she'll be able to do telehealth visits here, so you won't have to travel to LeGrand for that. Podiatry comes, ear, nose, and throat. Physician Dr. Funk comes over. Cataracts, ophthalmology, comes
really?
about once a quarter, so that is, he sees people and does the surgery here.
Okay.
Any others?
Those are the ones I can remember off the top of my head,
Oncology, do you?
Oh, yes, thank you, that's a big one. I feel like he's just part of us. He's here once a week, Dr. Bronstein for oncology. And he will come on site, also will do telehealth if needed.
And the hospital has oncology stations, right? Chemo stations. What about radiation?
We do not offer radiation here.
Okay.
That unfortunately is something, a lot of people will end up in Wallowa. They have an amazing setup, a home that they provide. You can stay out of their consecutive treatments, those kind of things. So, but we do work closely with those other organizations to try and make that as easy as possible. It's not easy by any means, but
Well, again, years ago, people getting chemotherapy had to drive to Wallowa
multiple times.
daily or
a week.
whatever, you know. Yeah.
We do a lot of chemotherapy through Dr. Bronstein. We have some great nurses that work in there to deliver those treatments. There's also some treatments for rheumatology, other different diseases, infusions that need to happen that they're able to provide here rather than having to go out.
And- Go ahead.
What's the workflow for bringing in new providers and having other providers let go? Not the local ones, but well, for example, I go to Wallowa for endocrinology, and if there's one of those in the world, then it doesn't make sense to have. But if there's suddenly 100 of them in Wallowa County, it makes sense to have that. What's the flow for bringing new people, bringing new providers in, and realizing that some providers don't need to show up anymore?
Well, we're always looking for new specialties to come to the county. We know that there is usually more than one that are going out of the county. I have connections with various hospitals, different regions in Eastern Oregon, Washington, Idaho, that we talk to on a regular basis. So if there's a provider that sees a lot of patients out of the county, we have a pulmonologist that has talked about how can I make this easier. I have a conversation coming up around congestive heart failure through Wallowa. They have a clinic that we apparently have several patients from Wallowa County that are traveling. So they may reach out and say, hey, is there something we can do locally to prevent people from having to travel? Or we hear about it, people asking us, and I'll reach out. Some of the challenges are physician licenses across state lines. They have to get a license in Oregon. Can be done, but can be a little bit of a challenge, time consuming. If they do telehealth, some of those same challenges around licensing have to happen. And then what is their capacity? A lot of them, their clinics are so busy where they're at, they don't have the availability to add anything extra. So I just keep putting those bugs in those people's ears so that if they do get a new provider, maybe they'll consider whether it's coming out once a month, once a quarter, or doing telehealth visits as appropriate to help expand those services. But we're always looking for opportunities to provide those kind of services to be able to keep people local and make it easier to receive healthcare. And they can partner with their primary care provider a little bit easier that way if needed. You know, the primary care provider could be in the room with the patient and the specialist if that's something that needed to happen.
Yeah, absolutely.
I know there was a request for dialysis. You want to say why
Sure.
that hasn't happened yet?
Yes, dialysis would be great if we could offer that service. The number of patients required to actually have a service that would provide quality care that would justify the cost of having that. We don't have that in the county. And then we looked at, is there someone that would come in? Is there a van that could come in periodically and do this? Just is not available at this time. So that's something that's always there in the background that we look at periodically to see if things
How many
have
people on
changed.
dialysis do you need to make it work?
Oh, I bet it's 20 at least.
Okay.
Don't quote me on that. That may
No,
change, but
I was just, I mean, are we talking 100 or are we talking 5, you know?
It's a little more than 5. Probably 50 or more would be ideal, but
Yeah.
and that would, again, that healthcare changes every day, so we'd have to relook at it, but it'd be a fairly significant number.
And that you're all set up so your orthopedist can do surgery here, right?
Yes, there will be some limitations. He has expanded what he does already. He's able to do some fracture repairs that we haven't done, partly because he's just in the county instead of coming over once a month. He's here able to do that. We've ordered a significant amount of new equipment so we can do a larger variety of cases. Yeah, Nick's going like this. I think we have spent well over $300,000 for new equipment. Thank you to the Healthcare Foundation.
Oh, wow.
For that, they've been very generous in helping us purchase that so he can provide more services.
Wow.
He
Yeah,
would like
that
to be
cordless
able,
drill that they use in surgery, it's a lot more expensive than the one you buy up the street.
So are
For
those,
good reason.
so are those little metal screws.
yeah, there was a saw he was, we purchased for him, and I shouldn't say this out loud, but those saw blades, you could probably supply your saw in the garage a lifetime for the cost of one of those. I think they were about $1,000 a piece, so.
I mean, we can chuckle and laugh about that all we want, but why? And this goes back to the healthcare levels and obstacle to care and all that.
Absolutely, yeah. You know, the state of Oregon, if you've heard, they're talking about trying to limit the growth of the cost for healthcare to try and help combat some of these increased exorbitant prices that we see. You know, there is a reason that's more costly than what I use to cut plywood in my garage, but does it have to be that much? And that is something that our leadership administration is constantly looking at, is how do we deliver the highest quality of care we possibly can, provide you the access to all of that at the lowest cost that we can. You know, we're not gonna skimp on quality by any means to decrease our costs, but we are very cognizant of that, wanting to keep things, you know, the cost down the best that we can.
And it's something that we as providers keep in mind too in treating patients, as we try to have it be an open conversation and try to make sure that we're extending their dollar as far as we can to get them the best care that they can.
Do you belong to a purchasing group?
Yes,
And is it effective in trying to at least reduce the cost of everyday things?
absolutely. We are a member of a purchasing group. The day-to-day supplies are purchased through there as long as they're available, and that decreases the cost. Some of these orthopedic equipment, that $300,000 we talked about, we go to that purchasing group every time we have a purchase that's not already set in the, I guess, day-to-day purchases, to see what is available through there before we just go out and make a purchase, so that we are getting the best cost possible.
Right, Jenny's really good at finding demos too.
Great.
She'll get a demo thing with, you know, and, well, you know, we wanna demo this for a while, and then we'll buy it, you know.
I've learned a few tricks along the
Yeah.
way.
At a used price,
Yeah,
right?
exactly,
Yeah.
yeah. And it's a
Brand new
significant
demo,
discount.
they have to discount it.
Another question, what's your relationship with Winding Waters and Triple H? Things seem to be smoothly connecting with the hospital?
We do work, especially the hospital, working with them. You know, they send patients over for imaging, for x-rays, CT scans, lab work. Patients are admitted as inpatients regardless of the clinic. The providers from that clinic will come over and see the patients inpatient. They do various procedures in the hospital. And the providers, the staff, all work together to hopefully provide seamless care regardless of which clinic. Now, they are both independent of the hospital and Wallowa Memorial Medical Clinics, but we're one big healthcare community that does work together.
You have the same IT system? Medical record system?
It is a similar medical record system. They're both different. They call it instances, but they do talk to each other, so you can see. So if Paul was seeing someone that had been seen at Triple H, he should be able to see the notes from the provider over there, or vice versa. If somebody goes to Triple H, they could see Paul's notes, pull those out, lab work, imaging.
I just had my annual physical yesterday, and it drew a blood sample here at Winding Waters in Joseph, and by 1 o'clock I had sent it to the hospital lab, and by 1 o'clock my chart had all my lab results in it, you know, 5 hours later.
So what about the tie-in with the Wallowa Valley Center for Wellness? It seems like that's the big kid on the block right now with the new building. So how are they gonna relate to Winding Waters and to hospital clinics?
I think it'll continue as they have been doing. They're their independent organization, but we do refer patients to see their providers. and the primary care provider would communicate with those therapists, counselors, as needed. Dr. Boverman, the psychiatrist, works with them. Patients are referred to him, see him. Again, they're in the same electronic medical record as Winding Waters, so those notes can be seen back and forth between providers as well.
Is there anything in Naha?
Not yet, but if we had a need, we have mobile abilities. We've done vaccine clinics down there, those kind of
I
things.
don't know what the population in that surrounding area really is
Yeah.
year-round.
We also, one thing that actually Wallowa Memorial Medical Clinics and Winding Waters have, as you know, several years ago, the home health department closed. They have visiting nurse services. So those visiting nurses will go out and do home visits, and they go to Naha, they'll go to Troy, wherever that need is. I know that all of the providers in the county have done home visits at one time. I just talked to a provider that fairly recently did one down in Troy. So it's available that way at this point. You know, if there was a need to go down periodically with a mobile service for whatever that reason might be, then that's definitely something that, and it has been done in the past, but would do again.
Years ago, we also had a hospice program here. Is there talk of reviving that?
No, that's a difficult program to maintain with our population, with our staffing. We did have an outside hospice agency that came in, tried to offer that service here that lasted, I think it was less than a year. They had trouble staffing it. We offer the same, the service, the nurses do, we call it palliative care, thank you. So they will go out to the home and offer that. There are a few things that the hospice program offers as far as benefits around medications, more the insurance side of things that we can't offer, but the care, you have the same nurses that provided hospice care that are doing this in-home care now. So I feel like the care is still as high, if not better quality. Some of the benefits are different because it's not the true hospice program. And one of the benefits to having the visiting nurses in the clinics is that tie-in with your primary care provider. They talk frequently, and so that relationship is there. They're knowing what your needs are and can address them very timely.
You want to talk about swing bed program and what that is?
Sure. So the hospital has what we call a swing bed program. It is a skilled nursing. It could be, I fell, broke my hip, went out to Wallowa, LeGrand, had a hip replacement. I need a little bit more time to get back on my feet, get some strengthening. I need some of that skilled nursing care. Can be referred back to Wallowa Memorial Hospital for the swing bed program. You're an inpatient in the hospital. The goal is to get you back on your feet so you're able to go back to whatever your home situation was. It could be somebody that was in senior living or home. Maybe that situation needs to change. You need additional caregivers. But that provides more intensive physical occupational therapy soon to add speech therapy to that. Nursing care, if I was in that program, I would be getting dressed, doing some of those normal daily activities. It could be working with me to prepare a sandwich when I'm home so that I'm okay, or washing a dish, making sure that I learn the new ways I need to do that, how to get around, how to walk up steps if I have steps in my house. So that's a program we use frequently, both if you go have to be sent out of the county and want to come back, need additional care, or someone could be admitted to our hospital but needs a longer length of stay. They will be switched into the swing bed program. As the patient, you don't see a lot of difference. You likely are in the same room. You're having the same nurses, therapists, physicians care for you.
Do you recommend that residents get a life-flight contract, and what's your relationship to them, and when do you decide to, ship somebody out?
Yes, I do recommend Lifelight membership. It is, I don't know what the current cost of it is, $90, $100 minimum.
I think it's 90 just for the lifeline, then if you add the local ambulance too, it's like
Yeah.
120,
So-
125.
I just did mine, it was 109, so,
A year.
a year,
A year.
a year.
Yeah.
Yeah, you can't afford not to have it.
No.
And one ambulance drive to Wallowa is about 20,000.
So, yeah,
But-
you're-
But doesn't, am I wrong? I think Medicare or Medicare supplemental covers it. I was
So-
told, because I dropped it.
The membership will cover anything that they don't cover, so it's a secondary backup.
Okay.
So
Okay.
whatever kind of insurance you have, they pay what they pay, and then this covers the gap.
Yeah.
So you're 100% covered.
Okay, so it's still advantageous then?
Yeah.
Oh, yeah.
absolutely. It will cover the local ambulance coming out to your house or out to the lake if you jumped off the rope swing and got hurt, whatever the case may be. And then if you do need to be sent to another a hospital that has a higher level of care, it would cover that helicopter or airplane ride if necessary.
That's 40, 50 grand.
Easy, yeah, it's definitely worth, even if you pay that 100 plus every year for 10 years, you've probably still
We get
gotten a
Yeah.
benefit out of it.
that.
You can sleep better at night, you know, it's knowing that you've got coverage.
And it covers your immediate family in your household, so it's not per person, it would cover yourself, your significant other, your kids. I believe if you're caring for family members, you know, you're their caregiver and they're in your household, it covers them as well. So we have a working relationship with them. We have information at the hospital, we provide this as a benefit for our staff as well. It's just something we encourage because we do
We
know
use
that.
a lot here.
We do. The helicopter comes in almost daily, the ambulance goes out multiple times, most every day, so.
Wow.
Yeah, I didn't bring all those statistics, but it's more than we think.
How on earth, if that is used every day by people in the county, how on earth does Lifelight pencil with doing that? Because if they are, you know, writing off $40,000 each time, how does that pencil?
Oh, that's a good question. I don't know if I can fully answer that. Maybe the number of memberships, they're getting, you know, $100 per household every year, and that balances out, helps them out. They're also getting some payment from insurance companies. And you know, their charges are covering all of their overhead, so hopefully they're making a little bit of money, obviously, so they can continue and provide that service for us. I haven't actually seen that written out. I can ask, we do now have a paramedic that started working for us that was working with Lifelight previously, and he was the kind of a PR branch manager out of LeGrand that's now working with our ambulance service.
Because if 1,000 people in the county had a Lifelight membership at $100 a year, well, there's that multiplication to how much a year. And 40,000 times 365 adds up fast.
Right.
I think they get a lot of reimbursement from insurance,
Yeah.
Pretty much.
Medicare,
Yeah.
whatnot, so it's just covering the gap.
And they do service a
Huge-
large region. They're in Washington, Idaho, Oregon, maybe even farther than that, so
Maybe Northern California too.
might be.
So we might be a lost pocket for them, which
Yeah.
which isn't surprising considering where we are and how far we have to go.
Right. But they're in Boise, they're in Spokane, Tri-Cities, Portland area, so that probably
Where we
helps out.
Where we send people basically.
Right.
Well, and we have, what, 2 ambulances of our own?
We have 4 now.
4 now.
Yeah, the foundation has helped us with 2 of those purchases that I'm aware of. So we have 4 ambulances. 2 of them are, well, they're all standardized so that regardless of which one you get in, the staff can know where things are, give great care, have all the equipment they need, but 2 of them are 4-wheel drive.
So
once-
is one in Wallowa too? Yeah.
They are still have one stationed in Wallowa. They have folks in Wallowa that will respond. The ambulance from Enterprise still responds to meet the folks in Wallowa, either at the scene, there've been times they've met on the road, on the highway, or just have communicated, and Wallowa could potentially transport all the way to the hospital if they've got things under control. But it is nice to have that response, rapid response.
So that's
in
another
Wallowa.
change, right? And I mean, now we have full-time EMTs.
Correct.
It wasn't too many years ago when the ambulance was all
All volunteer.
And
there still are a number that are volunteer, that continue to give hours and time and talent, but we do have, staffed
24-hour coverage of EMTs now?
24-hour coverage. Yep, some is on call. We actually just recently are changing that staffing model, so there will be someone essentially on site 24/7 and able to respond as quick as they
So
can get
that
out to
also
the
gets to
ambulance.
the ER room. Now, the ER, are local physicians still handling some ER shifts?
Mhm. Yes, the majority of the ER shifts are handled by local physicians. That includes Dr. Gary Ziegler, he's a board certified ER physician. He does only emergency room. He does 8 shifts a month, 24-hour shifts. And then we have a few, call them locums. They're ones that we have independently contracted with that will come in and provide some coverage when our local providers aren't able to do that.
Okay.
But it's nice because they're consistent, we know them, they're getting to know our community and our staff, so.
How far away is this? Is this like, LeGrand, or is this the contract out of Seattle?
LeGrand, Baker, Walla Walla. Trying to think if I miss any. They're pretty regional, so they'll come over and stay for the shifts that they're working.
Okay.
There's one that is a little farther away, but he's actually building a house in Joseph. That started, it's been in the works for a few years, and eventually would like to be in this area. So it's kind of a way for us to get to know him to get to know us, and see if this is where he eventually want to end up, if an opportunity opens up.
Do you have a public annual report?
There is a lot of information on the website. What report are you, what type of data are you
We
asking?
usually talk about programs that you started, and your financials, etc.
I'd have to look and see exactly what is on the website. I don't think that there's a report like that. I know that, the board meetings are public. You're welcome to attend board meetings. Any of that information, if you ever had questions, we have that information. I would be happy to share that with anybody, sit down and talk through, answer questions. It's definitely not hidden, it's available. But we don't have,
Yeah,
That-
with an elected board, we are a governmental entity through a special district, and so everything is public.
everything's public, so. There is some information, services, anything new that gets put on the website. There's a community health needs assessment that we do every 3 years, which is coming up. You may start hearing about that probably end of the year, beginning of next year. Some random surveys sent out, and that helps us determine what the needs are in the community as well. And that's done in partnership with Wallowa Valley Center for Wellness, Building Healthy Families, Winding Waters, the hospital and clinics, and Neon all kind of work together to get that done. It's all data that we all can look at and benefit from. That is posted on the website.
One thing our kids were just amazed at, they all live in larger cities, well, most people do. But during COVID, the home visits, and the accommodations that were made for people's health care was pretty amazing.
I did hear a fair amount of feedback on that. That was something that was really important to us, is that despite COVID, we wanted to make sure that the hospital and the clinics were the safest place that you could be. So we didn't want people to skip their health care. That's
Right.
could potentially make things worse in the long run if you're skipping out on visits, not getting, whether it's your blood pressure checked or diabetes, even just the normal physicals are still very important to do. So that was very important to us to be able to maintain that service for people.
So on that, while you're kind of on that, the COVID situation, I think we're up to, what are we up to, 55% now or something in the county?
Yes.
Vaccination.
55 or 60%?
It's somewhere in between there. I don't
Yeah.
have the exact number off the top of my head. I want to say 57, 58.
Yeah, well, we don't, so are the reasons that our numbers are not higher because of lack of confidence, because of lack of access? Are the people in, you said you went to Imnaha, Troy, whatever.
And if you're not certain how many people are there, then you have no business saying a vaccination percentage of people there, so.
Yeah, and I couldn't tell you based on community. What I know is it's the state publishing the numbers countywide. It's probably a combination. I think some of it is the vaccine, the hesitancy to get the vaccine. There probably is some access. I feel like our healthcare community did absolutely everything they could to minimize trouble to access. We had clinics in just about every community. Again, did home visits to provide vaccines for people that either were uncomfortable leaving their home or unable to leave their home. People went into all of the care facilities to administer to staff and residents of those facilities that wanted the vaccine. Multiple vaccine clinics were held. We had them at the Cloverleaf Hall and Enterprise. There've been some in Joseph, in Wallowa, Imnaha. I believe they did one in Troy even.
There were rumors at least that several healthcare employees were refusing vaccinations. And, I know there is a left-right anti-vaxxer movement here. And I just wondered how much impact that had and whether that actually creeps into the healthcare system.
Probably. I try not to talk politics at work, but
No, it's just the facts,
But it is here. I think it's in every community. I can tell you we are not 100% vaccinated in healthcare employees. That includes patient-facing ones that are working with patients every day, and then others that maybe are in the business office not seeing patients every day. I don't know. I can't segregate those two populations. Our percentage is higher than a lot of our other regional facilities that we talk to. I think there was some of that hesitancy at first, just talking with staff. I'll be honest, I probably researched it a whole lot more than I've researched any other vaccine that I got or had my daughter get, just with all the conversation that was out there. But I think over time we have seen the number of people getting the vaccine has increased. I don't know if you have any insight.
No, I think it's an interesting question, and it's tough to really come to a final conclusion on which one it is, what factors it boils down to. But it's the same thing that's playing out. Prior to coming here, I worked with vaccination drives out in Colorado, and it's the same kind of issues there as well. So, and not just Colorado, but nationwide.
I
So
think
you
Wallowa-
don't require the staff to be vaccinated against this virus or against the flu?
No, we do not require vaccination. If you do not flu vaccine, you are required to wear a mask if you don't get the vaccine. We would require the same likely. We haven't had to have that discussion around the COVID vaccine in healthcare. On any of our healthcare campuses, you are still required to wear a mask, staff and any visitors, patients, or guests.
And Oregon law does not permit healthcare to require vaccines. Healthcare workers are exempt under Oregon law, as well as law enforcement, parole, and corrections.
Wow.
Although anyone with a union contract that prohibits requiring it, and there's one other category I can't think of. I just looked it up on the website today.
Wow.
Because I got a question from a friend of mine via email, and I had to respond to it.
Wow, interesting.
Yeah.
So sometimes you hear reports about the huge disparities in pricing of procedures. 2 hospitals in the same city, and this one does a lobotomy or whatever for
go to the other
$2,000, and the other one charges $20,000. Is there a way that, as you set rates for various procedures and stuff, that you look around at the universe?
Yes and no. We can't call up our neighboring facility and say, hey, what do you charge for this? That's not allowed.
Okay.
They have fairly recently come up with.
Don't feel bad, we can't do that either.
Yeah, it's not just us. There is the price transparency that is now out, so if you go onto the website, you can look up colonoscopy and get the price for a colonoscopy at any hospital. So that is out there.
Oh.
The tricky part is what you need done for your colonoscopy could be different than what I need done. Maybe I need biopsies and you don't. I require the nurse anesthetist to give me the sedation, where the RN is able to do the sedation for you. So there's a lot of variation in the cost. Makes it even more confusing, but you can now, with the price transparency, get a little bit of an idea of what the cost would be. And you, as a patient, you can call up the facility and ask for an estimate. I know I've helped many times kind of put together, okay, here would be what I would anticipate, the basic, and then, close to needing all of the extras.
And that was mandated by, was that CMS?
It was, yes, yeah, federally mandated. So that's across the nation. It's supposed to be posted on every facility's website, so you can go on and look.
Who does your negotiations with insurance companies?
That is done through Joe Warner, our CFO.
Through
And that
what?
Joe Warner, our Chief Financial Officer.
Oh, okay.
He does all the negotiations. And we are limited as far as if we were to adjust our prices, we can't just say, oh, I'm going to charge 20% more for this and 3% more there. Obviously, with the cost growth cap that the state of Oregon has put on, that's going to limit things, but we also have limitations just regulatory wise and with insurance companies. You don't just get to willy-nilly assign prices, which again, I know is not unique just to healthcare.
Well, and the typical write-off on insurance is of like a third. I think we figure about 33–34% write-off of what the charge was versus what we actually received in the end from the insurance provider.
Most people my age either don't have insurance or have Oregon Health Plan and are worried about going to the hospital because it's financially crippling to do so, and don't have insurance because it's financially crippling. What's the game plan for the hospital of reaching out to people that aren't, that are reluctant to go to the hospital because of this pricing insanity? How does the hospital sell itself?
Part of what we try and promote is going to see your primary care provider, so you can go into the clinic, get your care done at an outpatient setting versus having to go into the hospital, which is more expensive than a clinic visit.
Absolutely.
You know, if you can go see Paul and he can manage things, check lab work once a year, whatever it might be, whether you need medications, get your wellness exam if you're due for your colonoscopy, mammogram for women, those kind of things, you can get those taken care of. So that helps to lower that. We talked about the financial assistance that we provide, sharing that maybe through a venue like this with people to know that we are trying to help eliminate or decrease some of those barriers so that you can come in and get health care, providing wellness activities, classes. We'll have some of those coming up even here in Joseph in the new clinic after summer. And those are at no cost, so providing education that way. I had another thought and I just lost it.
I think one thing too to think about, and I agree, I think that, prevention is a big key to that. I know it's difficult when you're saying if you don't have insurance to make that a first initial step to walk into the clinic, but you have to realize that a lot of the providers are moving away from this, I'm the provider, you do as I say, to shared decision making to make sure that the care you're receiving is driven by the patient, not by the medical system.
Well, though a lot of, if you get a blood drawn in Wallowa County, it goes to the hospital because that's where the lab is. So the hospital is involved in many of the clinic visits anyway. So saying, oh, be at the clinic, well, I think that's sort of shifting it around a bit because the hospital's still involved.
Yeah, I agree. The hospital is still involved in that's an astute observation because you're right. It does go to the lab in the hospital. In most cases, there are certain things that you can do in the clinic lab-wise, but just because it gets routed to the hospital doesn't mean that you get charged for an inpatient stay for having your lab drawn.
Correct.
Right.
Yeah, thankfully.
Yeah. So that shouldn't be necessarily a deterrent for people to come get preventative care.
And, the hospital, whether it's the medical clinics or the hospital itself, again, we have the financial assistance policy and are willing to sit down with anyone and work out payment plans. It may be, hey, I'm willing to do this. There's other things. I don't know exactly what their policies are, how they do that, but they can work with someone to help make it manageable and potentially find those discounts that make it so it's not quite so overwhelming. Unfortunately, we haven't figured out how to make that completely go away. I know that healthcare, whether it be the cost, the care itself, is overwhelming and scary.
Because they're saying, hey, well, it's cheaper, come negotiate. That's also what car salesmen say. And that doesn't wind up well for the customer. So.
Well, I hope that's not the experience, and I don't want to sound like a used car salesman.
But so is the future of healthcare pricing having a high school class where part of the saying is, here's how you negotiate for healthcare at the hospital? That's creepy.
Wrapping into personal finance, yeah.
Hospitals have enormous capital costs that they have to cover, so that's one reason for their prices. What percentage of your patients are commercial insurance, Medicare, and Medicaid?
Medicare and Medicaid probably makes up for the majority. I would say over 50%.
Wow.
Closer to 70%,
Yeah.
between the two.
30% would be commercial.
That's pretty close, and you can pull a little bit out for VA, and then uninsured
Or
and
self-pay.
self-pay.
What do you think the percentage of uninsured is in the county? Did Obamacare help? Do we have more people now?
Well, we've seen that kind of bounce up and down. It helped, and then with the cost of insuring yourself through that rose, people decided to take the penalty, so it was cheaper to do that and pay for your health care. They took the risk, they took that gamble. you know, with the expanded Medicaid in Oregon, that has helped people find coverage through Oregon Health Plan.
Oregon Health, yeah.
That
In
was-
our area, Eastern Oregon
That was
Coordinated
probably a
Care
bigger deal
was the
than,
one that helped the most.
Affordable Care Act.
Yeah.
I'm thinking of the graph that Joe shows us, trying to think of what our
But
self-pay percentages.
Medicaid, the Medicaid expansion really, what Nick's saying, really helped that.
I think it added something like 600 or 700 souls in Wallowa
In
County.
Wallowa
So
County.
10% of our population qualified under that expansion.
And
Okay.
that has, with COVID, with the, them not moving people on and off the plan as much, has increased that number some as well,
Yeah.
provided some coverage.
Well, thank you very much. I think we've used up an hour, and you've done a very good job. And this was recorded, right, DJ?
That is correct.
So this will
I
be
hope this
up
is on
on our
YouTube.
YouTube channel, and I will make sure that Brooke gets it, so that she can put it out on yours.
Sounds good.
And we'll tell other, I think it's great that you're willing to come out and talk to groups, and maybe we should all think of other groups too that you know, where presentations like this could, maybe DJ can get a group of whatever generation we're in now. Or maybe we should just do it at TG some night.
Yeah, they've got a stage and everything.
I think that'd be pretty cool. Instead of having, okay, I mean, Range Rider, TG, they're all looking for places to fill up on the stage, and usually that's bands and music. But
Yeah, I won't provide music, you don't want that.
but the example, Wallowa Resources has done, like, you know, science nights at pubs. I can well imagine there being, you know, an hour of medical nights of, you know, ask your healthcare administrator or doctor a question. Hopefully not a medical one, hopefully an administrative one. But
We'll send you to your primary care provider
Yes.
for the question, medical questions.
We do private shows for those.
Yeah. Well, thank you very much
Oh,
for
thank you.
having us. and-
No, thank you. And we've got iced tea and goodies over there, so we don't have your lunch, but you got your dessert over there, okay?
Perfect.
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 Yeah, thanks. Pardon? Yeah, most of them go in the back room.
Okay.
They were.
Yeah, we'll use them tonight for Lions Club.
Yeah. Well, good. I am disappointed. I thought we'd have more people here, but
It's all
you
right.
know, you never know.
It's more than last time.
Pardon?
So it's more than last time.
Yeah. But man, we had it out there too. We had it on our newsletter and on the. We'll